Well, the National Institutes of Health estimates that 300,000 deaths per year in the U.S. are attributable to the obesity epidemic. So joining us to talk about the medical complications of obesity is lead physician at GBMC Owings Mills, Dr. Kevin Ferentz. All right, thank you so much for joining us again. So talk to us about how important it is for patients to really understand the implications of being obese.
Oh, well, there are unbelievable implications. We're talking about almost 1 in 10 deaths in America being attributable to obesity. Obesity causes so many different diseases, diabetes, high blood pressure, heart disease. So there's a list. So blood clots, but things that you don't even know about that people don't realize is it increases your risk of cancer, breast cancer, uterine cancer in women, prostate cancer in men, colon cancer, kidney cancer. And so this is a big issue, right? That it's not just that people get overweight and they say, oh, you know, my knees hurt a little bit, or I feel a little bit short of breath when I walk around. Obesity kills. And at this point, 70% of Americans have a weight problem. About a third are obese, a third are overweight. About 15 or 20% are morbidly obese. So what's happening is we're getting so used to seeing people who weigh 300 pounds and 350 pounds that we're thinking, oh, well, that's kind of the way it is. But it's not. It's really not. It's a really serious health problem, and people have to lose weight because it's going to adversely affect their health.
Now, it says 70% of people have a weight problem. What's the difference between being overweight and then obesity?
So it's based on what's called the body mass index, BMI. And BMIs are just based on height and weight. A normal BMI is 19 to 25. So once you're 25 to 30, that's overweight. And once you cross what I call the O line, which is a BMI of greater than 30, then you're obese. And greater than 40 is called morbidly obese.
All right, so talk to us. I see people doing a lot of different things to try to lose weight, right? Let's talk to us about medications. Do those still kind of have a negative connotation or what?
Well, I'm really sorry if people do think it has negative ramifications, because I actually prescribe weight loss medication all day, every day, given how many people are obese. And we do know that the only two things that consistently work at helping people lose weight are medications, drugs like phentermine, and there are the 3 or 4 medications that we can use, but phentermine is probably the #1 that's prescribed, and weight loss surgery, bariatric surgery. And I have had, you know, hundreds of people that I've referred for bariatric surgery, and it saves your life.
I love it. All right. Well, Dr. Ferentz, thank you so much for joining us. Such informative stuff that you were talking about here. And again, thank you for busting those myths. We're going to put all of this on our website, and then our viewers know where to find you to get more as well. We appreciate you.
Awesome. Thank you.
Thank you.